Hi, I'm Robert F. Kennedy Jr., your HHS Secretary. I'm here with CMS Administrator Dr. Oz. Rural America is in crisis. Chronic disease rates are higher in rural communities than in our cities, yet rural health care is collapsing. Since 2010, 150 rural hospitals have shut their doors. Fewer than 4 in 10 rural hospital beds are filled at half the rate of urban areas. The human cost is devastating. Families drive hours for care. Communities lose their hospitals, their lifelines, and their economies. The old Washington approach was to throw money at failing systems, patching holes without fixing the foundation. That failed, and rural America paid the price. President Trump is changing all that. In the One Big Beautiful Bill, Congress created a Rural Health Transformation Program. This is a bold new approach, $50 billion across all 50 states, to rebuild rural health care from the ground up. And today we're announcing the process by which states can apply for those funds.
The program tackles the root causes of rural healthcare failure. It gives states the tools to design solutions that last, not Band-Aids that fail. At the National Governors Association meeting, we previewed the principles. The message was clear. This is not about sustaining failure. It's about building success. We recommend states consider 5 powerful models. Here they are. First, prevention. MAHA. Chronic disease drives more than half of our nation's healthcare costs. If we're serious about making rural America healthy again, then nutrition and physical activity and prevention must be priorities. Second big area, sustainable access. Rural providers can join forces. They can share resources. They can build innovative operating models that actually serve their communities. Third big bucket, workforce, people. Rural health depends on people. States can recruit and retain professionals by letting pharmacists and nurse practitioners expand their roles. And by streamlining licensing across state lines, all this becomes feasible. And without it, shortages are going to continue to choke rural health care. Fourth, innovative care models. They work. We can give doctors and hospitals stable cash flow while rewarding them for keeping people healthy, not just treating them when they get sick. That aligns resources with prevention and better outcomes. And finally, technology. Paint this, a picture a patient checking symptoms on an iPhone instead of driving 35 miles to the nearest doctor. Picture an AI-powered system replacing stacks of paperwork, cutting administrative work in half so providers can focus on patients.
This is a structural shift, not just another temporary patch. By early next year, states will begin using these funds to put real solutions in place. Rural communities are the foundation of American exceptionalism. They have waited too long for Washington to act, and now, at last, we are acting. We encourage governors to submit bold, audacious proposal ideas as strong as the people they serve. Together, we will build a rural health system that works, strong, sustainable, centered on patients, and we will make rural America healthy again. Rural America deserves a healthcare system built for rural reality, not an afterthought of urban leftovers. Right now, only 7% of Medicaid hospital spending reaches rural hospitals. That's got to change. The Rural Health Transformation Program is that change.
Produced by the U.S. Department of Health and Human Services.